What causes loss of appetite? A decreased appetite occurs when you have a reduced desire to eat. It may also be known as a poor appetite or loss of appetite. The medical term for this is anorexia. A wide variety of conditions can cause your appetite to decrease. These range between mental and physical illnesses. If you develop loss of appetite, you may also have related symptoms, such as weight loss or malnutrition. These can be serious if left untreated, so it's important to find the reason behind your decreased appetite and treat it. What causes a decreased appetite? A number of conditions can lead to a decreased appetite. In most cases, your appetite will return to normal once the underlying condition or reason is treated. Bacteria and viruses. Loss of appetite can be caused by bacterial, viral, fungal, or other infections at any location. Here are just a few of what it could result from: an upper respiratory infection, pneumonia, gastroenteritis, colitis, a skin infection, meningitis. After proper treatment for the illness, your appetite will return. Psychological causes. There are various psychological causes for a decreased appetite. Many older adults lose their appetites, though experts aren't exactly sure why. Your appetite may also tend to decrease when you're sad, depressed, grieving, or anxious. Boredom and stress have also been linked to a decreased appetite. Eating disorders, such as anorexia nervosa, can also lead to a decreased appetite overall. A person with anorexia nervosa undergoes self-starvation or other methods to lose weight. People who have this condition are typically underweight and have a fear of gaining weight. Anorexia nervosa can also cause malnutrition. Medical conditions. The following medical conditions may cause your appetite to decrease: chronic liver disease, kidney failure, heart failure, hepatitis, HIV, dementia, hypothyroidism. Medications. Some medications and drugs may reduce your appetite. These include illicit drugs, such as cocaine, heroin, and amphetamines, along with prescribed medications. Some prescription medications that reduce appetite include certain antibiotics, codeine, morphine, chemotherapy. Drugs. When to seek emergency treatment. Always contact your doctor right away if you begin to lose weight rapidly for no apparent reason. It's also important to seek immediate medical help if your decreased appetite could be a result of depression, alcohol, or an eating disorder such as anorexia nervosa or bulimia. How is a decreased appetite treated? Treatment for a decreased appetite will depend on its cause. If the cause is a bacterial or viral infection, you won't usually require specific treatment for the symptom, as your appetite will quickly return once your infection is cured. Home care. If loss of appetite is due to a medical condition such as cancer or chronic illness, it can be difficult to stimulate your appetite. However, taking pleasure from food by eating with family and friends, cooking your favorite foods, or going out to eat at restaurants may help to encourage eating. To help handle your lack of appetite, you might consider focusing on eating just one large meal per day, with light snacks in between. Eating frequent small meals can also be helpful, and these are usually easier on the stomach than large meals. Light exercise may also help increase appetite. Medical care. During your appointment, your doctor will try to create a full picture of your symptoms. They'll measure your weight and height and compare this to the average for the population. You'll also be asked about your medical history, any medications you take, and your diet. Be prepared to answer questions about when the symptoms started, whether it's mild or severe, how much weight you've lost, if there were any triggering events. If you have any other symptoms, it may then be necessary to conduct tests to find the cause of your decreased appetite. Possible tests include an ultrasound of your abdomen, a complete blood count, tests of your liver, thyroid, and kidney function. These usually require only a blood sample. An upper GI series, which includes X-rays that examine your esophagus, stomach, and small intestine, a CT scan of your head, chest, abdomen, or pelvis. What's the outcome if decreased appetite is not treated? If your decreased appetite is caused by a short-term condition, you're likely to recover naturally without any long-term effects. However, if it's caused by a medical condition, the condition could worsen without treatment. If left untreated, Your decreased appetite can also be accompanied with more severe symptoms, such as extreme fatigue, weight loss, a rapid heart rate, fever, irritability, a general ill feeling, or malaise. If your decreased appetite persists and you develop malnutrition or vitamin and electrolyte deficiencies, you can have life-threatening complications. Therefore, it's important to seek medical attention if you have a decreased appetite that doesn't resolve after an acute illness or that lasts longer than a few weeks.